The parents of another child who died after heart surgery at Bristol Children's Hospital are calling for a public inquiry. A report into the treatment of 4-year-old Sean Turner highlights staff shortages and poor recognition of his worsening state. His family are not the first to raise concerns this week. Our health correspondent Matthew Hill reports.
Sean Turner was born with a serious heart condition. He had an operation at the Children's Hospital in March. But his parents say their living nightmare really began when he was discharged to Ward 32 from intensive care, or PICU, only one day afterwards.
Sean was losing masses of fluid, up to 3 litres a day. He was getting chronically dehydrated. He was very, very unwell and a lot of pain. We were saying to the doctors and the nurses that we were worried that Sean wasn't safe where he was, that he needed to be in PICU, he needed an investigation as to what was going wrong, and they were saying no, he was fine here on Ward 32, he's in a high dependency bed and he's very safe.
We begged to go back to PICU. I think in the 4 days we saw one consultant who said that he'd had major heart surgery and this was to be expected.
Said he looked fine to him.
Yeah.
He wasn't concerned.
No, and then on the Thursday, as they were preparing to look at Sean, because they had a meeting to go to, and they would look at him after the meeting, Sean had a cardiac arrest in my arms.
Sean was then admitted to intensive care, but 4 weeks later he died of a massive bleed in his brain. A hospital review into his death highlights suboptimal nursing staff on the ward, a failure to recognise his deteriorating condition and poor communication with his parents. Later, when they complained, Sean's parents say a senior member of staff admitted families had been given the wrong impression about the level of care.
We were told that Bristol actually didn't have high dependency beds and that they had misled families into believing they did have.
The hospitals say Sean Turner was a seriously ill child with an unusually complex heart disease. They say the clinical team did their best for him on an hour-by-hour basis as his condition changed. They say a review of his care has identified where it could have been improved, and they've apologised to his parents for any shortcomings.
When patients are discharged from the paediatric intensive care unit, we have an outreach service, which is a nursing team, a specialised nursing team, that help provide care for those patients for the first 48 hours of their care on Ward 32.
Just 3 weeks after Sean's death, and 7-year-old Luke Jenkins died on the same ward. And the report into his death found staff shortages were partly to blame. The coroner has now been persuaded to have an inquest. Sean's parents hope that will give them some answers. Matthew Hill, BBC Points West, Warminster.
This week we've had a number of reports about the care at Bristol Children's Hospital throughout the last 9 months. First, there was Luke Jenkins, whose death, as we said, was partly due to staff shortages. Then on Wednesday, more cases came to light. We told you about 3-year-old Jack Casey and 9-week-old Oscar Wilcox, whose parents both said they were found lying in their own vomit. And now we hear this case where Matthew is here with us now. Matthew, in fairness to the hospital, they do deal with some very, very sick children. But can you see a pattern developing here?
Well, these concerns do go back 2 years when there was a near miss, if you like, and it was recognised then that there were staff shortages. We've had these 2 deaths, we've had 6 other serious incidents related to staff shortages. So there is a lot of concern at the moment. Yes, they are very, very sick children, of course, but the hospitals say they are working on improvements to make the place, and they believe the place is safe, and safety is the key word.
We're getting slightly mixed messages here because the unit has been highlighted as a centre of excellence. There are plenty of accolades for the Children's Hospital, and yet we're hearing of these cases.
Well, the mortality data after 30 days of an operation is very good. You know, it's 2 years old, but it is very good, and it's one of the top 3 in the country. This is all about post-operative care, and these are concerns which the hospital will be addressing when they say they're going to bring forward the date of the opening of a new high dependency unit where there are more nurses basically to each patient.
Okay, Matthew, thank you very much.